So every time the meditation has something to do, direct relation to what we are going to be discussing with the presenter on that class, on this class. So this time I invite you to, as always, find a comfortable position, sitting or laying down if you prefer. If you're sitting, see if you can sense the support that the chair or the couch or the floor offers to your body. And the same if you're laying in bed. And if you're sitting, see if you can keep your spine more or less straight and your body relaxed. Sometimes it helps to have a little cushion underneath so that there is a slight position of the hip a little bit forward so that it immediately brings the spine straight. There. And from this comfortable position, we close our eyes or lower our gaze so that we are not distracted with the surroundings. And we bring attention to the sensations in the body and to our breathing without trying to change anything, just turning the gaze inward. Noticing how the air comes in and out of your body. Accepting what is at this very moment. And with curiosity, exploring now what happens if you deepen a little bit your breath in the inhalation without forcing. And have a slow exhale so that the exhalation is a little bit longer than the inhalation. Probably there's a slight pause at the end of the exhale. When you inhale again, inhale like sighing, relaxing, slow, relaxed inhalation. And maybe there is a slight pause at the top of the inhalation. And a slow exhale, inviting the body to relax. Just finding your own rhythm of inhaling through the nose, slowly, gently, and deeply. A slight pause, and then a slow, long exhale, a little bit longer than the inhale, if you can, without forcing. Inviting the body to relax. So let's do 3 more of these at your own pace. I will be silent. Always inviting the body to relax with every exhale. And being totally content with whatever is happening, befriending our present moment. And now I'm going to teach a meditation that I usually teach as a meditation of the 3 centers, and today it's going to be connected to compassion and the vagus nerve, and the 3 centers that come from ancient cultures as main vital centers. One is at the abdomen, one is at the level of the heart, and one is at the level of the forehead and the brain. And so we are first bringing our attention to the level of the abdomen and practicing a little bit of abdominal breath. As we exhale, we bring the abdomen in. When the time comes to inhale, we allow the air to go all the way to abdomen without forcing, just gentle. And finding a rhythm of exhaling, bringing the abdomen in. Slight pause. Inhaling, allowing the abdomen to expand. And inviting a sensation of grounding, of safety. We're going to do 5 of these breaths. Inviting compassion for ourselves. This area of the body energetically, the area of the abdomen, has a lot to do with our relation to ourselves, according to ancient cultures. And according to Polyvagal Theory, is the area that when we have senses of being under threat or imminent danger, it takes us to a sense of isolation and of closing up. Like our old ancestors, the reptilians, the turtles, we just kind of close up when feeling threatened. But now we're inviting a sense of relaxation and compassion to ourselves. Also, sometimes we are harsh with ourselves, and it produces this sense of unease and of doubt, and sometimes shame, guilt, different kinds of combinations. So we just exhale whatever burden we might have in our relation to ourselves, whatever form it takes. We exhale with the air, layers and layers of that, and we inhale a sense of safety, self-acceptance, compassion to ourselves. Let's do 5 of these breaths, exhaling through the nose or the mouth. In this abdominal breath, that when you inhale through the nose, the abdomen slightly expands with great compassion for our situation. And when we exhale, we just relinquish some of these layers in whatever measure we can right now without judging, just exploring like children this possibility of self-acceptance and compassion to ourselves. To cultivate a sense of safety within ourselves, we begin with our relation to ourselves. Not judging anything, accepting the journey that has brought us to this moment. Knowing that we all struggle in one way or another with our own relationship to ourselves often. And letting go of those layers of feeling limited, powerless, whatever form it takes in our life. As we let go of the negative, we open up to feel the sense of compassion, self-acceptance. We are okay. We are safe right now in this present moment as we practice in this group of friends. And we always have deep within ourselves this resource We just need to cultivate it a little bit every day, in whichever form we can. So that we can open to the experience of feeling relaxed and resting. Like a gecko under the sun. And now we move to the area of the heart. You can bring one hand or both hands, if you like, to the heart, to the area of the heart. Another major plexus of nerves, and very important for our heart health and the health of our lungs, and also very important energetically. And from the point of view of polyvagal, this is the center of Polyvagal Theory. This is a center that it's came to us during our mammalian evolution. And so we went from the reptilian, mainly concerned with oneself, to the mammalian heart that cares and engages in caring for the offspring and of each other, and pro-social behavior and play when it's feeling safe. And when it's not feeling safe, then it gets mobilized and it either tries to run away or to engage in fight, to defend. So it goes from feeling safe to feeling the need to be protected, and then has this reaction. So with our hands at the level of our heart, we are just going to do a few deep breaths. Inhaling like sign. Exhaling and relaxing. Feeling the expansion of the chest as we inhale. And then as we exhale, we let go of whatever burdens we might be experiencing in the area of relationships, to other people, to nature. Well, nature usually is just peaceful and waiting for us. But so whatever burdens might there be there in connection to our relation to others. With great compassion for ourselves and for our nervous systems that sometimes enter in mobilization, in fight or flight. And also for the nervous systems of other people, perhaps facing us in a difficult situation, that also go into fight or flight. So we keep inhaling slowly, gently, and deeply to have a sense of grounding and being present. And we exhale, letting go of the tensions, possible tensions in relationships. Inhaling slowly, gently, and deeply, we feel the expansion of our chest. We invite experiences of love from our past or our present. In the exhale, with great compassion for ourselves and our limitations, and also for the limitations of others, we relinquish some of the burden we are carrying. Keep inhaling slowly, gently, and deeply. And see if you can do the exhalation a little bit longer than the inhalation. That will trigger your parasympathetic nervous system, which is the one about relaxing, resting, repairing. Just experiencing the possibility of safety, love at this present moment as you breathe in this safe environment with this safe group of friends. And allowing your body to experience that sense of safety, communication, opening, at least for this moment, so that you can remember it. Experiencing love, connection. And noticing how in subtle ways, as you first connect with yourself and this sense of safety and self-acceptance and compassion, and then in the relationship of yourself to yourself, and then bring it to your relation with others, also with compassion, you start feeling a little bit more of space inside, opening in whatever measure is possible for you today, without judging, just like children exploring. And if only very little is happening or almost nothing, according to each sense, don't despair. It's the first time you're doing it. So this grows as you keep practicing. The brain and the heart and the guts, they learn through repetition. So we are exploring today this little taste of calmness, generosity in the way we look at ourselves with others and others with us, and compassion. This helps your vagus nerve to relax and all the organs that are innervated by the vagus nerve to relax too. And finally, we bring the attention to the beginning of the vagus nerve when it exits in the cranial area, the brain stem. And from there is a connection to the front of your face, or more or less around the top of your nose, the space between the eyebrows, is this other very important energetic center in ancient cultures, and also because of the nerve plexus and important glands, the pituitary gland, the pineal gland, that are in this area. So now we are going to open to our evolution. We went from reptilians to mammalians to human beings that, when are in a state of peace, are able to communicate more creatively, more caringly, and also somehow remember that we are all in this together, and that have a sense of oneness and peace. So almost like if it was the light of the moon that's illuminating everything without making difference on what it illuminates, that sense of oneness and peace, that sense of being in connection with everything and not resisting or fighting, but being open to learn from every experience and knowing that we are all in the same boat together and we are all spirits in a process of learning and developing. So we are going to bring the attention to the area of the third eye, and you can put your hands together like in prayer if you like, or just keep them still at your heart and do a few deep inhales and exhales. This time bringing the attention to the area of the forehead softly. You could wet your right thumb. We practice from classical yoga, and gently wet the area of your third eye if you like. And that will help you to kind of keep concentrating there in a gentle, relaxed way and having a few deep breaths, inviting a general sense of peace, like if you are sitting under the moonlight on a summer night and you are the light, a sense of oneness. Of belonging to life. Of inner peace. Letting go of any limitations and opening to the enormous potential we all have in our body, our mind, our heart, our guts, our interconnections, our connection with ourselves, full of potentiality. Inhaling slowly, gently, and deeply, inviting a sense of peace and of light. And remembering moments of peace that you have had when you had felt at oneness with that moment, with that place, with those friends, with you. With great compassion for the human condition and the many challenges each of us face. And with trust that we have within us the inner resources to work with whatever arises. And that it takes commitment, practice, a little bit every day, in whichever form you find that works for you. A few more deep breaths, integrating the sense of safety at the level of the abdomen, of love at the level of the heart, and of inner peace at the level of the brain, informing and responding to whatever is coming also from the abdomen and the heart up. And the brain is confirming everything, showering everything with light as it receives input of safety and of love, connection, and it goes into communication and oneness. Just invite it as an experience. Don't judge. How is this going to happen? When is it going to happen? Just open to the possibility and remembering that you have had these experiences. Okay, so now we are going to go into, oh, it was a long meditation, sorry about that. So we'll have to discuss about this in our next class, because we already have here Dr. Stephen Porges, and I'm just so happy that he's here with us. So we'll do the transition now to introducing Dr. Porges. Okay, great, here we are. Steve, so wonderful to see you.
Good to see you again. Right.
Always. So we have the great honor and pleasure to have with us today Dr. Stephen Porges, who's very famous from his research on the vagus nerve and the polyvagal theory. He has 3 books: The Polyvagal Theory from 2011, The Pocket Guide, which is really a wonderful series of conversations with psychologists and how to apply this in the treatment of trauma and other problems. And then the polyvagal safety, which was a baby when we interviewed him last year around this time. And it's also a wonderful series of conversations now applied to areas of education, prenatal care, even yoga, all kinds of, and COVID and resilience and quarantining, everything. And has written more than 400 peer review articles and received all kinds of honors, and is professor in several universities. But if I would read the whole thing, it would take us a very long time. So we're just so happy to have you, Steve, with us, and to have the possibility of conversing with you.
Well, thank you for inviting me. It's good to see you again. Last time we spoke, the hurricane was coming through. So
yeah, we were talking about just in the beginning of Hurricane Ian. Yeah. So I want to, if at all possible, talk with you today about a little bit of the development of the polyvagal theory, in the sense that in the beginning, it was, well, you presented it in 1994 and then had the first book in 2011. And at that time was well received and continues to be very well received by the group on psychology, and they were especially interested in the applications on trauma. So maybe we can talk a little bit about that. And it seems to me that you have been also, it has been very welcome in the area of education, and also of now of groups of wellness. And so it has gone from trauma to optimizing human experience. So can you tell us some of the, why did it revolutionize the field of psychiatry? I mean, I know why, but I would like you to say
okay, there are different dimensions here. When it got into the world of trauma and psychiatry and psychology, it provided a plausible understanding of personal experience. So what was happening to people who had survived severe trauma is their body shut down, but they were living in a world that assumed that everything was stress related, and they defined stress as arousal and activation. And so they were being very confused. They talked to the therapist, and the therapist would say, I guess you were really anxious, or you're really mobilized, or you must have been producing a lot of cortisol. So they came up with all the metaphors of a mobilized defense system. They didn't acknowledge a immobilization defense system. And so when they started to read about polyvagal theory, it gave them an understanding of what their body was doing for them. So it was, in a sense, their nervous system was saving them, doing literally a heroic event, immobilizing them to support survival. In fact, the theory was a theory developed based upon the literature in animal research. And I had, and also with high-risk newborns, that's the other important aspect, that when you do research on the high-risk preterm or during delivery, you realize that there's a real vulnerability of what's called apnea and bradycardia. And that's where the heart rates go very slow, and the kids stop breathing. And this is really the risk factor. And so when people often take home heart rate monitors for their risk children to monitor these events, because there's a vulnerability for a neural generated bradycardia. And I was trying to figure out that. And that's really where it all came from. I was trying to figure out
that what?
Oh, I was trying to figure out what were the lead indicators for infants in which they would go into a bradycardic or like sudden infant death syndrome. So where their system would, in a sense, shut down. And when I was doing my research, especially in the neonatal intensive care unit, I was seeing a pattern of heart rate that preceded the bradycardias. What it was a pattern that lost this ventral vagal respiratory rhythmicity of the ventral vagus, and it became tachycardic. So heart rate went up fast, and then it crashed. And in the world of, I say balance theories, people say, well, you go too high, you have to come back down. But what they hadn't thought about was really the underlying mechanism. When the heart rate is going up in that preterm baby, it's metabolically costly. The baby can't sustain it. And the nervous system then goes into a earlier, evolutionary earlier, and also a embryologically earlier neural circuit of basically shutting down.
Okay.
And so the real issue is that we have a toolkit, and part of our toolkit is a shutdown response. The problem is, as a mammal, as a big mammal with a large cortex, we require a lot of oxygen. And so where the shutdown response may be fine for a mouse, it's not very good for a mammal, for a large mammal, a primate like us. We need our oxygen. And so going into those states are not only will you pass out, but you could fall and get really injured. So you're not getting enough oxygen to your system. So it's not just a fall and injury, it's the hypoxia, not enough oxygen in your blood. So
okay. We need to stop just for a moment, because there are some terms that perhaps listeners don't understand. One of them was the ventral that you mentioned.
Okay. So we have to let's unfold. Well, let's unfold. You need to know your evolutionary journey to becoming a social mammal, and we can think of this evolutionary journey as mammals evolved from very, very ancient reptiles. The ancient reptiles were not very social. They're extinct now. So our common ancestor with modern reptiles and mammals occurred over 200 million years ago. So it's in the distant past. But when mammals came into this world, they had some attributes. One, they could nurse. Nursing is a sucking and swallowing, and that required a ventral vagus, a different place for the vagus and its cardioinhibitory fibers to move to. So we had to integrate our regulation of our heart with ingestion. And in your practices, we use terms like social nourishment, taking in food, ingestion. They become overlapping neurophysiological feelings because they're the same system. So our ingestive system became our social engagement system as mammals further evolve. But the important issue I want to bring out at this moment is this ventral migration in the brainstem. So ventral is really towards the front of our body and dorsals to the back. And so when reptiles have their area that regulates the vagus, it's in the back. And during our own embryology and during this transition from reptiles to mammals, there was a migration of these cells to the ventral part where they became intertwined with the nerves that regulate our face. And even though this sounds very complicated, it's all about the practices that you were doing, whether you touch your head or you do your breathing or you chant, because that is linked now to the regulation of your heart. And when we feel safe, it percolates up the sensory part of the vagus and affects the nerves regulating our face and our voice. So this So the point of this whole journey is we are a species that is the product of a journey of ventral migration to become social. Now, the interesting part of that is, are we willing to claim our heritage, or do we basically neglect it? And that heritage is, as a species, we cannot maintain our health, our own homeostatic functions, without interacting with others. So
Beautiful.
we are a dependent species, like the baby that is born can't survive on itself. We're not like a turtle who comes out of the egg and scampers off into the sea. We're dependent, and we're dependent through our whole life. Now, we create substitutions, and some of those substitutions are pretty good, like people feel safe with dogs, but not with people. Dogs aren't bad, cats aren't bad, but snakes aren't very good, because they don't have the face, they don't have the voice, they don't have the same nervous system that we have, or similar to us.
So I realized that we would also need to discuss just a tiny bit about the vagus nerve itself that starts at the brain stem, and then there are a pair of 10 cranial.
Yeah, well, we want to not really overemphasize the nerve itself.
Okay.
We want to basically think that the nerve is a wire. Now, wires are not intelligent. They don't carry much function. I mean, they go to things, they bring signal. They're basically, the vagus is the primary brain-body connection. That's all we really need to think about. It's part of our surveillance system of our body that goes up to our brain, and it's part of what our brain is doing to regulate our organs. And this is really going to touch into the world of what I am working on now, and that is to understand functional disorders. And this is something that I'm sure several people in this group have carried the diagnosis, like functional GI problems, which is one is irritable bowel, functional neurological. And what does that mean in a medical model? It means they can't find organic damage or disease. So they basically say, I don't know what it is, I'll give it a name. But they don't have a practice which, that's, by the way, what you're doing is really going at functional systems neuroregulatory. So functional disorders have no organic, meaning end organ damage. But medicine is all about tests of the organ, not about tests of the neuroregulation of the organ. And so when neuroregulation of the organ gets disrupted, you lose your ability to regulate health, growth, and restoration. So your end organs become vulnerable for disease. So the first reaction is this withdrawal of neuroregulation, and those are functional disorders.
And the regular medicine was not able to do much about it. And then what I find very hopeful and empowering since I discovered the Polyvagal Theory, one was what you were mentioning as a trauma survivor, suddenly understanding why my body didn't remember particular 2 days of my life. And then the other very hopeful and very much empowering was that, okay, now it becomes, I am part of my body. My body is giving me signs. I can work with it. I can understand. And I'm going to come back just for a moment to the vagus nerve very shortly, in the sense of just sensing from the base of your brain to your colon. Okay, because we're talking about pathways in the previous class, and the person was talking about the gut, the heart, and the brain. And so the vagus nerve there, but then as you are mentioning or noticing us, is more about the physiology and the psychophysiology and how the states and the physiology totally interrelate, and then cause these symptoms that sometimes regular medicine doesn't know.
Well, regular medicine, basically, when I lecture in medical schools, they weren't taught this. That's not what they were taught. They were taught about an autonomic nervous system the way it was taught in 1920. And that was really structure. And so they know their organs, and they know the organs are connected. The interesting question is, when you deal with a physician's internal medicine, you just ask them what's the role of the nervous system in regulating whatever organ is their specialty. They may acknowledge it but they won't be able to give you much of a clue. But that neuroregulation is that missing link between, quote, stress, anxiety, trauma, and the manifestation of those states in our body. And you actually mentioned the magic word. The magic word was state. So polyvagal theory is not about damaged organs. It's about a nervous system that shifts state from a state that supports homeostasis, to which means health, growth, and restoration, to a state that supports defense. It could be defense, fight, flight. It could be defense dissociative. It could be defense shutting down and withdrawing. But those are defensive modes. And our body, we are a social species when we are safe. So when we are safe, our homeostatic, our body works. But part of that working is co-regulation and interaction with another. So sociality is part of our homeostasis.
I love that part because it also reminds us of our that we have evolved to develop pro-social behavior and to move together forward, which is something that our world is needing so much right now. And caring for each other, assisting each other already is very beneficial for us, because it's just like we are like mirrors.
Yeah, we're taught things that aren't correct. We're taught that we shouldn't be, quote, bleeding hearts. We shouldn't give of ourselves. We should think of ourselves first. We should take care of ourselves. And that misses the point of our evolutionary heritage. Our evolutionary heritage is that through connection and co-regulation, we thrive. Through cooperation, we benefit. So our sociality is a neural modulator, enabling us to be not just happy, but healthy as well.
Right. And that's what we are trying to do in this course of meditation, volunteering, and positive neuroplasticity, approaching it from many, the possibilities we have to work with our nervous system and also of the interaction between each other and the importance of meditation and breath and different ways of contemplating and relaxing. Yeah.
Don't minimize volunteering. don't minimize that, because that is the reaching out to other.
Exactly.
And the issue is how you reach out within a polyvagal theory has to have a degree of let's say, accessibility, and you have to be sensitive to the other. So giving to another and making them feel that you are giving to them because you see them as disadvantaged is not giving at all.
Right.
It's something else.
We have a beautiful article that's called The Difference Between Helping, Fixing, and Serving. And the
fixing is
no.
Fixing is once you get into that mode, and this is actually a discussion we have in the house, and that is the knee-jerk reflex is to fix something that is broken. And that is not what a relationship is about. It's not about fixing anything. It's about witnessing, listening, and sharing. So fixing gets in the way, and we have a society that, including medicine as part of it, that's about fixing. And the other part, which we haven't really talked about, is that in the medical world, like the educational world, like everything in our world, we see it as cause and effect. And clinical trials is a perfect example. Clinical trials assumes that there is nothing in between, no nervous system, no uniqueness of the body. There's a treatment, there's a person, and the individual differences, let's say your neuroregulation, your trauma history, your basal level health without getting disease markers, is random noise in those models. And the real part is that they are intervening variables. That's a fuzzy word. It means that whatever the state of your nervous system is, it affects how these treatments work. Exactly. So if you're coming into getting a certain medicine for a certain ailment, and you have a close, safety, trusting relationship with the physician, your body is now accessible for intervention, and the intervention may work. In psychotherapies, my view is that it doesn't really matter how you're trained, meaning the type of therapy you use. The real part from my perspective is how accessible, how co-regulatory are you? So there are master therapists, and getting a manual, or what we would call in the trade, manualized treatments, don't work or are not effective or as effective. Some things are extremely powerful and they do have some effect. But if you want to optimize the effect, be a co-regulator, be accessible to whoever you're working with.
And you have to start by being kind to yourself and knowing yourself and knowing your state of your physiology and psychology responding, and then also being open to others. But yeah.
Well, let me add to that, and that is the word of honoring and respecting, meaning that there are days when you're not accessible. There are days when you feel bad. There are days when your physiological state biases your perspective of the world, and you think everything is negative. That's all being broadcast from your body, in your face, in your voice, in your gesture. That impacts on others. So you can feel bad. I'm looking at you directly. You can feel bad, but you still have a responsibility that you know you feel bad. So understand that your feeling bad can project and be broadcast to others, who will then feel bad.
Right. In which case, take a little break, go for a walk, go in nature, and nature, it's a big mama.
Use the
Will calm
toolkit.
you down.
Use the toolkit that you're teaching. Use the toolkit. It can be as simple as a moment. That's right. A moment of feeling your own body, a moment of slow exhalation, a moment of even just touching. So you find you have boundaries, you exist.
Smiling is super good. And I learned from you also yawning.
Well,
and chanting.
yeah.
Right? Those are simple, more or less simple.
Yeah. But so is talking. So often people, when they are kind of anxious and want to talk to someone, they become overwhelming to the other person. And if the other person wants them to stop their chatter, their anxious chatter, it's not by dismissing them or looking uninterested. Look very interested, and then it will slow up. Be accessible, and it will calm them down. The issue is that when we start broadcasting our own threat reactions, we end up basically pushing the other person away. The person is human also, and they'll react.
Great. Robert, can you put us side by side? It seems that we are oscillating here between one of us, at least in my screen, one of us goes in, and then I lose the other one. I would like to have both of us together here, if at all possible. If not, that's okay. Whatever it is, we'll work with it. So what I find so fascinating about what you are telling us, what I find so fascinating about what you are telling us and all the discoveries that you have brought into the world with the polyvagal theory and with the understanding that the vagus nerve has, and our whole physiology has different ways of responding, either the freeze or the fight flight or the more communicating, depending whether it feels under threat. It's this possibility that also, as you were saying just a moment ago when we were talking about the relation doctor-patient, is that a lot of the responsibility, but a lot of the opportunity is put back into ourselves. So it's an invitation to assume our whole potential as mammals, as human beings, and to trust that we can work with ourselves and that we can work with this first noticing what's happening and then being able to observe it and somehow embrace it and then use different tools to become more grounded and open. And it's a slow, long process, right? It just takes
what you're emphasizing is self-awareness.
Self-awareness. And compassion, because sometimes one has self-awareness and flagellation. That doesn't work.
Well, blame and shame has no real, when you become, you're absolutely right. It's self-compassion and self-awareness. And it's really, I I continue to be shocked. I shouldn't be shocked because I live in this world of people who have had challenged past, but I'm always shocked by how people feel shame and blame, that they, and in a sense, imposter syndromes and all these things that people talk about. They, in a sense, they're so uncomfortable in their body that they can't even be in their body. So they're projecting something that is not who they are. And I think what the toolkit that you've been teaching and the toolkit that Polyvagal Theory shines a spotlight on is really what's the strategy for us to come home to ourselves. And then who are we? And this is what I start talking about frequently, that is claiming our phylogenetic heritage, claiming this sociality, seeing sociality as this neuromodulator. We don't need vagal nerve stimulators. We need sociality. We need to interact with people. So the problem with popular culture is that it hangs on certain words. So the vagus becomes a word. People want the nerve to be a godsend.
Yeah. The same happened when in neuroscience, they were mainly thinking about the brain. They were thinking about chemical impulses in the brain or mechanical or whatever, and just not understanding that we are a whole organism with body, mind, and spirit. And since we are talking about that, I'm very curious about your trip to India. Can you tell us a little bit, when did you go to India and what were you expecting to find there and how long you were there and whether it had anything to do with
it was a long time. It was the early 1990s. And I had a very good friend, a scientist from India who I met when he came to the University of Maryland, where I was a professor. And we just got along very well. And he had brought neuroscience to India, basically. That's what, and he had one, he was very well decorated with awards from India. And we got along very well. And he wanted me to come visit, and we were going to go on this kind of journey, which we did. And so I spent
India, Southern India, where
all
over.
No, well, gotta be. This is getting.
Okay.
No. I lost the name of the town. I'm trying to remember it. It's the dirtiest, noisiest town. What is it in India? No. Well, anyway, I went there, and it was just crowded people, and then I lived in a basically a Ramakrishna mission, an institute of culture for a month, and we went up to Darjeeling. We went up into the Himalayas, basically, and we went and we visited Buddhist temples, and start to get into dialogues about lost knowledge, because the whole model was that embedded in rituals, in religious rituals, was a neurophysiological basis of life, or how people should take care of themselves. So before organized religion, there were rituals. And I later met a person, her name is Jelti Gordon, and she put together a book called Rituals in Modern Life. And I have a chapter in that, and it was basically, it's very similar to the chapter in the book on safety, which is about a neuroscience of compassion. And it was really about postures, voice, chanting, and listening as being really part of our long history, prehistory of a species, and how we regulate ourselves, how we found nourishment, and how we regulate ourselves, and how we did these things in safe environments. And I even describe the size and the power of, let's say, medieval cathedrals, where you're in a safe place, so safe that you can have an organ playing low sounds, which is natural for our body to, in a sense, react to, because it's like earthquakes, volcanoes, people walking behind us, and still be able to process it, not with fear, but with a sense of awe. So there is such wisdom in the creation of these environments for a type of bodily feeling of exploration. So anyway, I went to India and later wrote a book, which I didn't publish, which I will share the title with you. It was called Conversations with Shiva, a Biotheology, which was really what I had learned on the trip, was that there was the possibility of creating literally a spiritual guide, a biotheology that was consistent with our body, that wasn't like much of our Western religious perspectives are really fighting with our body. And I said, why would that doesn't seem like the most, let's say, plausible or efficient way of having spiritual experiences. So I started to write about that. It basically was about, it's kind of a mock documentary, in which we go, my friend and I go, and we are given a myth, and he translated, but we weren't given a myth. I made it up. And the myth was about basically the last days of Shiva on Earth, and what he had decided to give people, and it was an understanding of their own bodies. So
that's so beautiful, because in a way, a lot of the ancient cultures are a empirical science of the body, mind, and spirit connection, and they always talked about this integration of the different dimensions of oneself, and then the spirit is not seen as out of the box, ruling into the box, like some creator separated, but we are this consciousness. We are one of the flames of the big consciousness. And so it's a very different understanding and relation to consciousness and to the bigger spirit around us and inside us. I mean, if it is everywhere, of course it's inside us too. And so how do we work with that? But yeah.
Well, I would totally agree with you, because this is I would say, the byproduct of a cause and effect reality, or a world that tries to structure that, including the relationship with deity as being outside the individual, and as opposed to an accessible individual who's part of the deity, which may be heresy in certain religions. But the idea is, yes, this is actually the secret of our evolutionary heritage, and that is we're a connected species by definition. And this is really the remarkable journey. And when we appreciate that our survival was through cooperation and exploration, and we start understanding that even spirituality can occur when we're in a state of threat.
Right, right.
So, I mean, it all becomes the same. When we are safe, we are sociable, but when we're safe, we're compassionate, we're generous, we're benevolent, and we can be spiritual as well as creative and appreciate so much more of what reality can be.
We feel the oneness. And now we are going to go to questions and answers, because
I remember it was Calcutta, excuse me.
I thought it was, but I mean, I didn't want to start throwing names. I mean,
no, but Calcutta was
quite the Ganga River and the people bathing.
Well,
the corpses.
There's a theme that I continually repeated through the book, and that is, where's the wisdom on the streets of Calcutta? And the answer became quite clear. You can't have that wisdom, you can't have that sensitivity if you're in a chronic state of threat. And that was what was on the streets of Calcutta.
Right. So then Mother Teresa came.
Well, that's also, I went out there. I didn't
we won't go there.
but again, it's a really interesting world when you see literally different levels of livelihoods of people living on the street. So there's almost like different stages, versus a cardboard house versus nothing versus sleeping. It was something that was it's overwhelming. And then it was the first time in my life that I was physically so different than the people around me, which made me a target, and I was not used to that.
a target for asking for money or whatever.
Yeah, and that is
Hordes
transformative.
of children, hordes of
Yeah,
asking.
that's transformative in how you react to people. So, it starts off with benevolence and generosity, and then it becomes survival. Your body goes into that state, and it's very revealing because it triggered in me this ability that I didn't know was there, that where people are no longer people. And I think that becomes a secret of how the world has fashioned itself by breaking the connectedness amongst people. We think of some as not equal, therefore they are not us. We create all these convoluted views, what they really are. And it's really it's sad to get triggered into that state and not have as the resources to step back and to try to understand that that's not the feelings we should have about humanity.
At this conversation we're having, Steve, because it just reveals so much behind the polyvagal theory and the psychophysiology and the understanding of the different states of the nervous system. And I will sacrifice continuing talking to you personally, but I want to invite also the questions from our group. Billy, can you help me a little bit with some of these questions? I'll start with one. Any tips for supporting co-regulation, our tone of voice, our posture? I think you mentioned could be helpful.
Let me say that the best cues of signals for co-regulation are, it says, the true signals, how you feel. That if you try to fake it, it may not work. So there's a degree of authenticity that is very critical for our bodies. Our bodies seem to detect it. So when you're not feeling resourced enough to be accessible and engaging, a person who is, in a sense, risk aversive will not have the accessibility to welcome your attempts to engage them. So realize that people are sensitive. And when you're in roles of, let's say, responsibility for others or managerial roles, I ran a large laboratory for years. And if it was a bad day for me, actually, it took me a few decades to realize if it was a bad day, meaning about grant money or article publications or arguments with the chair, I had to, in a sense, tell my staff that not to overread my cues. But even doing that, it wasn't sufficient because they looked to their lab chief as someone who will protect them. It's like a parent. Or when I was a department chair, the same thing. People will overreact to your cues. They'll make something out of it.
So there is like a tango here, because the other person is already in threat or alert, and then you are perhaps not having the capacity to, we are in a capacity to embrace them, then what to do?
Yeah, well, it becomes, I really enjoy this segment of my life because I can just be accessible. It's just, if I'm in public, I can be accessible. If I'm, I don't mean Zoom is moderately accessible, but, it's not like there's a hierarchy in my life. See, this is the issue when you're an academic. There's a hierarchy in your life. When you're in, let's say, upwardly mobile in whatever profession you're in, there's always a hierarchy. And which means you're selective with how you interact with some people, but maybe not as selective with others. But in this stage of my life, it's all the same. So it's kind of like I can be who I am. And that part I really enjoy.
Yeah, it's the greatest gift, and it keeps us giving opportunity to work on ourselves, also to be more available to others. And that's something that I really admire of you, because although everyone is asking you to participate here and there, you are always, accessible and very spontaneous and authentic. So I really appreciate that.
Well, you're special. So
Yeah, I remember at the end of our talk last year, you said, I want to learn with you. And then
Yeah.
we did connect, and now
Yeah.
we are exchanging
Yeah.
learning, and it's
Yeah.
so beautiful for me with you and with Sue.
Yeah.
Okay, so here is another question. I mean, there are many, but I'm seeing some. Can you explain why a person would get an increased startle reflex and general hyperreflexivity if it has also MS symptoms?
Oh, MS. Yeah. Well, if we talk about MS and other disorders, the body is basically the body's in a state of threat. So in a sense, they're kind of like generalized threat reactions that are associated not merely with psychiatric disorders, but also with physical disorders or health issues. The nervous system is shifting its state to, in a sense, deal with a disease. And that disease, when you get into MS, is going to knock you out of that calming vagal component and basically put you more into a fight, flight, startle reaction of the sympathetics. Yeah, it's quite predictable.
So can we explain MS a little bit for people who might not know?
I don't think that's easy to basically.
Yes. So if one would have to define MS for some.
Well, the issue even on that is that the diagnosis is also vague. And so there are people who carry that and carry other disorders like Ehlers-Danlos. They may get that diagnosis from one person, MS from another. It doesn't have the specificity of it. And even when we get into things like Parkinson's, it's some of the same issues. There are functional changes that now they have a name for it. And the issue is, my view, and this is where I think polyvagal theory comes in, and that is you can have these diseases, you can have as functional, I would say damage, but limitations, but you can optimize what you have. So
Right.
you take a more optimistic perspective. So I have people who are using the intervention. I developed the acoustic intervention, the Safe and Sound protocol, working with Parkinson's patients.
Wow.
And very slowly, but working with them, and they're smiling and they're moving. It's not easy because the body is fighting that calmness, because part of the disorder is to change and get the hypertonicity. MS has some of these same features, Ehlers-Danlos, which is joint hypermobility. It's not just hypermobility, it's a subtype, but it's not just that. The real debilitating features are high anxiety. What does that mean? It means the body's in a state of threat.
Right. And it affects everything, the digestion, the peristaltic reflex, everything.
Yeah. Well, what we want everyone to take home is that if your body is in a state of threat, it's not merely that startle reaction. It has to do with the signals within the body maintaining or disrupting homeostasis. So I don't like terms like stress or anxiety. I'd rather operationalize and say you're disrupting homeostasis.
Right.
Now we are inside our body and we know what's going on. When we use the word stress or anxiety, we tend to attribute it to something outside of us.
Yeah, yeah. And so let's try to come back into balance.
Yeah.
Regain health. Let's try to come back into inner balance, into physiological balance, into, yeah.
And on top of that, it's not like there's going to be a great range of what balance is for you versus me versus Sue versus other people. But we have to be respectful of the state we're in. That's where self-compassion is all about. You don't have to be like me. I might have or might have had. So with aging, you start getting the same things. You know you're different than what you were 15, 20, 30 years ago. It doesn't make it bad. It just makes it different. And you need to honor those differences so you can optimize your life. That's what this is all about.
Let's work what we have and let's optimize our life. And it covers such a big range. I mean, you have articles on gerontology, on neonatology, on everything. Okay, so let's see what else do we have here.
Amelia, here is one. Has Dr. Porges worked with or interacted with the folks studying the use of psychedelics for healing trauma, anxiety, and depression?
No, I haven't, but my wife has a little bit. I have, again, I think we have to be very careful. There's some actually positive findings, but from a polyvagal perspective, we want to emphasize that it's the understanding of the internal physiological feedback loops are critical. And again, what the psychedelics are being presented as if it's like a pharmaceutical intervention that will take away the effects of PTSD or other mental health issues. I, I think it's wishful thinking. It doesn't mean it's not going to happen, because I've heard of transformative experiences from people that I do know. But I realize that we need to emphasize, this is where my responsibility is to emphasize, if we're going to take them, we better enable our body to be accessible to them, welcoming to them, and not in a state of fear. So everything is going to be structured about the preparation and about the context in which you're taking the drug.
This reminds me a lot of what my teachers used to say in India. And they would say sometimes people try to work with the energy of the Kundalini. Let's suppose it was the energy of the nervous system. And they said it's not something external. You cannot just, bump or do heavy breathing or whatever. It has everything to do with your behavior and your conduct. And it will move slowly up as you understand yourself better, and as you are better in relationship with others. It's a very subtle and a very continuous every day and for the rest of your life. So it's just like you have to have patience, persistence, and the understanding that we are a whole integrated organism. That's not just something, that's going to be injected and change everything. I mean, people have facelift operations and they are still feeling the same inside after everything outside has been so-called fixed, because you have to work with the inside. I mean, it's an inside-out job.
Well, the facelift is actually a very interesting one, because it tends to affect the afferents, the ability to sense things and feedback. So people who have had, let's say, heavy Botox treatments have difficulty socially interacting because they're broadcasting inappropriate cues. So they're not showing accessibility. I want to go back to your point on Kundalini. And I think Kundalini is a perfect example or parallel to a psychedelic, that it is something that is overwhelming and potentially transformative, but you better be prepared for it. Yeah. I mean, in the world of Kundalini, people talk about unresolved Kundalini experiences, and those are novices who got themselves into those states. And it's been transformative to them, but not in a positive way.
Right. The teachers used to say it's like if you are running higher voltage on a system that's not prepared for that. So you go integrally and you'll be safe and you'll be healthy.
What you're doing is, I keep using terms like neural exercises, you even terms like you work on this. People don't like those terms, they want fixes, but you're in a sense expanding the range of your nervous system, and that's what you're talking about with Kundalini. I don't know about psychedelics, so it's going to be very interesting because it's gotten mainstream. And so I don't know.
So here's another question. In earlier evolution, why was shutdown helpful for survival rather than flight?
Wonderful, wonderful question. Because when I developed the theory in 1994, it was long before Google searches. And I apparently missed some literature because I went back to it this past month or so. And what you find out is, based on the species, if the species utilizes freeze and immobilization as defense, like mice, rats, rabbits, guinea pigs, they have a lot of dorsal vagal activity. If they're like cats and dogs, you can put an electrode in the dorsal vagal nucleus and the heart rate will not change, but the contractility and blood pressure will change. So in a sense, the cardio inhibitory, the vagal efferent activity on the heart coming from that dorsal nucleus doesn't work in certain mammals. But if the mammal is a a mammal of prey, food for another, that's there, it works.
Okay, can you translate this thing about the dorsal and
Okay, so the
whatever?
dorsal vagus is that shutdown. It's where the shutdown neurogenic bradycardia occurs. And in the world that you're in, that dorsal vagus will also give you diarrhea. It will also give you vasovagal syncope. You could pass out. So it's part of a integrated shutdown response. And this is really what many survivors of trauma will talk about. The real issue with the neurophysiology, until I started to find that literature, was really ambiguous whether in many mammals this system actually worked. And what I think is also happening is that during, let's say, perinatal or developmental sequences, like a lot of, if we look at early childhood trauma, a lot of people who have, let's say, retuned autonomic nervous system, it's not about something that's occurring today. It may have occurred when they were very young. And when they report these from their own questionnaires, we see that that's the variance of that effect of early trauma is accounted for by whether their autonomic nervous system was retuned to be stuck in defense.
Okay, and we have a hand here from Alan, who is wanting to ask something. He spends a lot of time in nature, and I think for some reason. Alan.
Yeah, thank you. And I just wanted to thank you for a great talk today. I watched last year's talk by you, and I was this one was equally as good, but in different directions. So thank you. My question, and it actually segues neatly onto what you were talking about, is early childhood trauma or even childhood trauma, especially in the context of an unsafe home. And, you know, from what I understand, you're talking about that calming influence of the vagal, the ventral vagal nerve is not really in effect, and you're sort of stuck in this panic mode. And what would you suggest that someone do to address that?
Well, that's a very good question, as you know, and the answer is it starts first with understanding what's going on inside you. So there's a degree of awareness, and the next one is the appreciation of those states that may appear to be disruptive to you. So you need to, not necessarily you, one needs to honor the experience. And then the narrative that starts getting developed after you honor that experience is that, look what this did for me when I was young. And in a way, you're welcoming that experience, but you're changing the narrative. And so you're breaking the link of that physiological state with all those feelings of vulnerability. And that's what good trauma-informed therapies are about. They're about separating the feelings from the story and giving respect and honor to the feelings, because the feelings are physiological. Our interpretation is the elaboration, the narrative, the meaning, the story. That's what gets us stuck.
Okay. And I just, you know, when you were talking about vacuum cleaners and loud noises and all that, I'm like, whoa, like
well,
check all those boxes.
Okay, let's focus on that. That is a body that is, as you would say, in hyper alert. And from my terminology, it's the downregulation of attributes of the social engagement system, which is basically when that vagus moved ventrally, it got intertwined with the nerves that regulate the muscles of the face and head, including the middle ear muscles. So when you lose that neural tone to the middle ear muscles, it's because you're usually in a state of hypervigilance. And if you look at people's faces when they're in a state of hypervigilance, flat affect. If you listen to their voices, intonation disappears. The voices lack the prosodic intonation that would be calming. So the whole system works together, and we can see it on different levels. So if you're checking, then you need to take some more, let's say, deep abdominal breaths, slow exhalations. You need to go into nature and listen. You need to inhale through the nose, which I'm sure you've been trained on. and basically allow the exhalation to come out very slowly, because when you exhale slowly, you're literally giving permission for the ventral vagus to do its job. And if you do reverse it, in a sense, inhale slowly and exhale rapidly, that's what we call hyperventilation. You're turning off the vagus and getting yourself really riled up. And if you look at anxious people, or if you've ever been in an argument, and I'm sure everyone's been in an argument sometime with someone, watch how the person who's arguing with you is breathing. It's always going to be short exhalations, and they're going to be taking in, they're going to extend the inhalations to get that anxiety, because they want the energy to fight. Not, I should say want, their nervous system is preparing them to fight. So I got to always be careful about the intentionality. But the nervous system literally has its own, has a mind of its own, we can use that. And the nervous system is trying to save you, even if that saving is to fight and hurt the hand that is trying to support you.
Thank you so much.
Yeah, and that's what I find so beautiful about the polyvagal as a neuroscience of compassion. That's total compassion for ourselves, for our situation, for the person in front of us. And yes, thank you so much, Steve. I mean, when you come, it's always such a gift. We are very thankful.
Well, you're quite well. I'm losing my prosody. You see, I think
what's going on?
And when I lose it, there goes my accessibility. So then the talk won't work.
Well, I know that you have another meeting just right after this.
Yeah.
So much, and happy Yom Kippur, and
Thank you.
be well.
Thank you very much. Good to
Thank
see you. And listen, nice to meet your group.
Yes.
Take some slow exhalations, feel it in your abdomen, let the air come out. And as you do that, feel welcoming to others and accessible to the world.
Gracias. Thank you.
Bye-bye. Bye-bye.
Bye.